right, thanks so much. Well, I am joined by Dr. Khaled Ajib, who is a urologist with Albany Urology Clinic. Good to see you and welcome.
Thank you. Thank you so much for having me
And we're
today.
talking about conditions that affect both men and women
Correct.
today. How prevalent is urinary incontinence and overactive bladder? We see all the commercials.
100%.
Oh, yes.
Yeah,
Yes, yes,
100%. So it is like estimated that more than 50% of women after the age of 50 do have overactive bladder or urinary incontinence.
All right, and then there are different types?
Correct. There are usually like 3 major types, but the most common ones are 2: stress urinary incontinence and urge incontinence. Stress incontinence is when women mainly have weakened pelvic floor muscles and they have urinary leakage, for example, when coughing, sneezing with physical activity. And urge incontinence, usually we see it like the symptoms are usually like some urgency and a frequency and not being able to control urine before making it to the bathroom.
And what about that urge?
Yes.
You know, when you've got to go, or
you
at
have
least
to go.
you feel like you've got to go.
Correct. You feel that you have to go and you should go. And sometimes, like if there wasn't like a facility, like a bathroom right next to you, then
you might have an accident.
Correct.
Now, what about treatments?
So treatment first, before we discuss any treatment with the patients, usually we have some diagnostic workup to determine whether the problem is with the bladder muscle in itself or some nerve issue. And then we go, and the treatment is usually some medical therapy and behavioral therapy. So we advise like women, for example, to avoid caffeine, avoid spices in food, and some pelvic physiotherapy. And medication-wise, it's usually like a category of drug called anticholinergics and beta-3 agonists. Now the next step, if patients do fail medical therapy, then we have options like injecting Botox in their bladders. Yes,
really?
Botox in the bladder, and that can decrease the urgency and the frequency. And the other one is that we can stimulate the nerves going going to the bladder, like with placing devices that again stimulate those nerves going to the bladder and decrease the urgency and the frequency.
Is that the neuro stimulation?
Correct, 100%. And like we have like InterStem device that we use at the clinic. And just to mention that everything I mentioned, like from diagnostic work up to these procedures, can be done at the clinic and the surgical center.
Okay, and insurance normally covers that.
All these, yes.
Okay, and again, we're talking mainly 50 and above, but do you occasionally have people?
Yes, we have sometimes young patients. We do, like especially young female patients or young male patients that underwent some pelvic procedures. Also, we see those cases. Yes.
Well, let's talk about prostate screening
Yes.
for men and some of the stats that you're seeing now.
So prostate cancer is really quite common in men. I would say like 1 in 8 men will be diagnosed with prostate cancer at some point during their lifetime. And in African Americans, it's even like a bit higher, 1/6. And they had a study from Scandinavian countries, like they took autopsy from several men, and the percentage can reach more than 70% after the age of 70.
And is there any, I'm thinking diet, I mean, what contributes to that?
Honestly, like it's mainly genetic risk factors. That's the main thing. And recently they found that there is a correlation between BRCA gene and the risk of getting prostate cancer. So it's mainly genetic and age.
Okay. The other thing, in terms of where Georgia ranks,
Yes.
9th?
Yes, so Georgia ranks 9th in comparison to the other U.S. states in regards to the number of new prostate cancers diagnosed.
Okay, and again, you're with Albany Urology?
Correct,
And,
yes.
and if you have questions, you do recommend that screening?
100%.
Get
Screening
the
is
screening.
really important, especially in men after the age of 50. They should discuss that with their family doctor or the urologist, and sometimes even at an earlier stage in case of strong family history.
All right,
Yes.
thank you so much. A pleasure to talk with you.
Thank you so much. Thank you.
And stay with us, everybody. We'll be right back.